Hi everyone, welcome back. I am Seema Anand and today I am joined by Dr.Pritha Dasamapatra, who is a gynecologist and obstetrician here in London. Pritha, thank you so much for joining us.
Oh, it's a pleasure, Seema. Thank you for having me.
So, Pritha, I want to today discuss a subject which I think is never talked about. We have no information on it, but it is extremely important, which is bleeding during sex. Now, I know that when we talk about bleeding during sex, people think of it as bleeding during first-time sex. But of course, it isn't only during first-time sex that you bleed. It can happen at any time. And the other myth is that it only happens when the hymen breaks. So it's only like a couple of drops or nothing at all. But in fact, it can be a great deal of blood sometimes. We had that awful incident not so long ago with the 23-year-old who bled to death during first-time sex. And her poor boyfriend at that point was sat there trying to Google how to stop it, what to do, and she bled to death in the meantime. And the problem that happened was that between the fact that there's lack of information and there's the fear of being judged that made him probably not call somebody for help. So I would like to, for our audience, clear up some of these misunderstandings and myths. So I'm going to start with actually asking the most simple question. Why do some women bleed during their first time and others don't? How much bleeding is considered normal? Which I'm sure that there is no such thing as normal, but I'm going to let you answer that one. And what could cause excessive bleeding, and at what point do you feel that you need to see a doctor?
So, answering your first question, why do some women bleed and some do not? Now, if I slightly move away from my core subject and go over to yours, which is sex education, you have touched upon this a million times, that the experience of sex can be different. So first time sex does not necessarily need to be full-on penetrative intercourse, is it? It can be just a little bit of experiment and you're not entirely sure what's happening. And then when you go further down the line and you have had sex a few times, you realize what you had the first time wasn't proper sex. So the experience of women are going to be different when they have sex for the first time, and also our anatomies are also different. Now, different does not mean normal. There are very few things where we have a hard and dry definition of normal. When it comes to pelvic anatomy, when it comes to how things look down there, the vagina, the vulva, the hymen, there can be many variations of normal, and some women may have a thicker hymen, which may be more prone to bleeding. Also, one thing to remember is that nature is very clever. So the vagina was created to have sex so that we can have fun, of course. It was also created as to be a birth passage for a baby. And most women, especially when they're giving birth for the first time, almost 8 or 9 out of 10 women are going to have some sort of tear. That's part of the physiology. Any kind of tear in any part of the body, even if we leave it unattended, it's going to repair itself. And one of the core ingredients that is needed for good repair is a good blood supply.
Yes.
So the vagina has a lot of blood supply that we probably indirectly recognize when we have an orgasm and it seems like everything is blowing up. But the blood supply is also required for healing after childbirth. So compared to, say, the skin of our hands, the vagina is going to have more blood. So any kind of tear will show itself more in a vagina than in other parts of the body. So I guess for some women who may have thicker hymen or longer or larger size hymen, they may experience more bleeding, or they may bleed during sex, whereas others may not. But then it also varies. Some women may not have had the full-on penetration during their first time sex, and maybe that's why they did not bleed the first time, but they had bleeding later on in their sex life.
It's interesting that you should say that, because I recently had a message from somebody saying, I'm a virgin, I've never even fingered myself down there, but I did not bleed in first time sex, and I feel almost disappointed And I was thinking, okay, I mean, first of all, really you need to get past that. But this is a really good explanation for why it is that maybe you didn't bleed during first time sex. So what you're saying is that some people can bleed, some won't. It's anatomical. Yeah, it's just how your body is created.
Exactly. It's and all of them are normal.
Okay. Now, at what point do we say, because generally we think of the amount of blood that comes out, and as you know, I had done recently a video after that terrible incident with my daughter, whose experience in first time sex was that she bled so much that she panicked, she thought she was hemorrhaging, it was a horrible situation, poor thing. So what people asked us was, so what is the point at which you call a doctor? Because when she called the doctor asked her, how much did you bleed? And she gave them a vague sort of idea where she was like, it was like a period, maybe it was half a cup, maybe it was just a little bit more than, maybe it was a cup, I don't know. But the doctor at that point said to her, it's okay, it's normal. A lot of people go through that. What, in your estimation, is the point at which you need to call a doctor?
Definitely if you're hosing. If it's continuous spurting of blood, that is not normal. Now, once again, this is also one area where there's no definition of normal. It's like period bleeding as well. People ask how much should we bleed, but there's no such thing as a normal volume because different people bleed differently. But I guess for this one, I would say if it's like period bleeding and it's thinning out, it's not continuing.
Okay.
So you have a sudden bleeding, but it's gradually becoming lesser and lesser. It's like bleeding from any part of the body. If we have a paper cut or an accidental knife injury in the kitchen, then we have a bit of more bleeding. We put our finger under running water, and then slowly it stops. If it follows the same pattern, it should be okay. But anything more than that, you definitely need to seek medical help. But also what I tell my patients is that listen to yourself.
Okay.
You will know, have trust in your own instinct. No one knows your body better than you. If you think that this is not right, then please go and get yourself checked.
Okay, so that's an interesting point, that if it is actually just bleeding at the same level continuously, that is not okay.
No.
But if you find that after a little while it starts to slow down, how much, I mean, I know we said that you can't be specific, but how much should that little while be? Like, can you give us a vague kind of idea?
I mean, within a few hours. I don't expect bleeding after sex to continue for days, like a period or even longer. But
the thinning down of the blood, would you say 20 minutes, half an hour?
I mean, an hour, give or take.
Okay.
But also see how you're feeling. If you're feeling dizzy, if you're feeling unwell, definitely if you think that your orientation is being affected, these are signs that the blood loss is significant enough to affect other parts of your physiology.
Okay. So I guess the takeaway from that is that no, there's no such thing as normal. This can happen at any time during your sexual life.
Yep.
It's not necessarily for the first time.
Absolutely.
And if you find that there is a lot of blood, give it a little bit of time, maybe give it half an hour or so to see if the blood is still gushing out, if it's still gushing, if it's hosing, as you said.
If it's hosing, then you don't even have to wait for half an hour. If it's hosing, go to an emergency.
So if it's spurting out, like almost like a tap.
Yeah, exactly.
You need
that
to go
is absolutely not normal. Please go and get yourself checked out immediately.
Okay. But if you find that there is a lot of blood and then it sort of stops, almost like a period, then you're okay.
Then you should be okay. Yeah.
Then you should be fine. You know, it's still such a difficult thing to really talk about because there are no rules. There are no hard and fast rules.
No, absolutely. I can understand that the answers I'm giving out may sound pretty vague. But the thing is that any woman, as you said, can bleed at any point in her reproductive life for different reasons. Maybe at the beginning, it could be because first time sex or early sex, the hymen is breaking up and slowly your final vaginal shape is being formed. But then even in later on in reproductive life, if I talk about postmenopausal period, when the body doesn't have estrogen, the vagina and the vulva and the surrounding areas are slowly getting dried up. If someone is not on hormone replacement, then that dryness, like any dryness in any part of your skin, that dryness can make the skin around friable. So sex at that time can also lead to bleeding for different reasons.
Okay. So what I've done is I've actually made a little list of things that could cause bleeding.
Yeah.
As a layperson who really doesn't know.
No, you know a lot, Seema. I am being modest.
No, but I've kind of made a few points over here, which I think are something that people are likely to face. What I'd like to do is address them one at a time, and then maybe we could sort of. So the first one, of course, is the hymen being different in different people. I know you addressed it already, but we could have anything from thinner hymen, thicker hymen, septum.
Septum, and also when you're talking about hymen, what we called a hymen that has not opened up congenitally, as in someone was born with a hymen that is completely covering the opening, and if you try to force and penetrative intercourse, then that can also lead to trauma. However, when that's it, when that kind of hymen is present, then usually people have problems not menstruating, not having periods, and that leading to other problems as well. So most of them would have identified it before they reach the phase of having sex. But septum you mentioned.
So if you can explain also for everybody what.
So these are what we call congenital, i.e. someone being born with it. Septum is a condition where there's a wall-like partition within the vagina. So the vagina is supposed to be a hollow cylinder. When there's a wall, that means there's an extra tissue with its blood supply, nerve supply, and everything else. And when you're trying to put something inside the cylinder, that part can get traumatized and that can lead to bleeding. It is not a very common condition. Okay. It is a rare condition, but it can be one of the causes.
So the hymen could either be slightly thicker or thinner, or more elastic or less elastic, or it could have a
imperforate hymen,
so
like a covering,
like a covering over it, or like a little wall in the middle.
Yeah.
And trying to have sex with something like that is likely to cause bleeding.
It can, yeah.
And it is likely to cause a little bit more than a couple of drops of blood.
Yes, it can possibly happen. Now, the more times a person has sex, obviously the vagina also adjusts itself, the vaginal size as well. It's an elastic organ, as we all know. So even with a septum, most women can have normal sex without any bleeding. They are going to become pregnant and have children. So that's all fine. But this is one of the things that can happen. And this is why we advise that if you carry on having bleeding, then get yourself checked, even if the bleeding is not large in quantity.
Okay, so basically what you're saying is that even if it's 3 drops of blood, but it is continuing for months, it is continuing for years, it needs to be checked.
Of course,
so
yes.
It's not just about huge amounts.
No. And even if you self-examine or your partner examines you and you have done your Google research, Google is a wonderful resource. I think we can all agree on that. But it cannot solve all our problems, sadly.
Yeah.
There's no way you can check yourself and know exactly what is happening inside.
Now, the second thing, of course, I know that you already addressed it earlier by saying that at some point you could get dryness, and that dryness can cause problems. But could we sort of talk about it as lack of lubrication?
Absolutely, lack of lubrication. I know I mentioned postmenopausal period, but that's not the only time in our lives we can get dry. We get dry during the second half of our period cycle, which is called luteal phase. It's normal. That's how the hormones are getting things done. Unfortunately, we have to adjust to our waxing and waning of hormone levels throughout our lives. And also another phase in a woman's life when dryness can happen physiologically is when she's breastfeeding.
Okay.
because your breast milk is sucking fluids out of you. So it's, I know you talk about lubricants a lot, and we should always have it beside in a bedside table anyway. But especially when you're breastfeeding, you do need lubricants. Otherwise, it can be painful, and the dryness can also cause bleeding.
I also thought it was very interesting when you said about the luteal phase, because I didn't realize, and it should be normal that you realize, because that's where the progesterone is coming, we're basically getting progesterone. And yes, of course, you become more dry at that time. You become more drier. Because there's less estrogen and more progesterone. Yeah. And please, can you explain to everybody what is the luteal phase of our period?
So, when we are having the bleeding, that's the time when you're having periods. From the time of thinning of the periods, roughly the first 2 weeks is called the ovulatory phase. That's when the ovaries, which are the two organs on two sides of the womb, are producing eggs. Usually in a month, one ovary produces one egg that goes on to full formation. That is the ovulatory phase that lasts for the first 2 weeks after the periods are over. And then you have ovulation, roughly around the 14th day. Once again, it is not written in stone. It can be plus or minus a few days, but let's consider it to be 14th day for ease of communication. After that comes the luteal phase. So once ovulation happens, for about 48, 72 hours, you can get pregnant, and then the egg that was produced, that starts dissolving, that starts becoming non-functional, and also the body changes. But the body doesn't yet know if you have become pregnant or not. So the body is producing progesterone to sort of have some kind of a support in case you get pregnant. If you really are pregnant, then your placenta is going to take on the function of the progesterone. But if you're not, then everything is going to thin out and come out in the form of period blood. So the 2 weeks preceding period is what we call the luteal phase. And that's the time when vaginal secretion decreases and you can become naturally dry.
I think that is such an important thing for people to learn, because whenever we talk about lubrication, particularly from a lot of the male partners, it's always like, I'm enough for my partner, I'm sexy enough, she will be turned on by me. Please understand that there is actually a point when no matter how aroused she is, the amount that her body is able to produce is not enough, because that's just how our bodies are made. Yeah. It's a biological thing. Absolutely. And I also get people sometimes writing in saying, no, but I go to a naturopath and I go to a yoga instructor who says that if you treat your body right, you never need lubrication. Please, as we've just heard, there is a biological phenomenon that leads the body to produce less lubrication.
Absolutely, yes. We have to work with what nature has provided us with. And sometimes we need extra tools. That's fine.
My God.
Like we're wearing glasses.
I take them off when I have to look, and then I put them on again. Yeah, I just wish that we had more sex education. Honestly, there are things that you're telling me which honestly I did not know. So
the other condition that can not a condition, the other situation where vagina can become dry is when someone is on contraceptive pills, because that contains hormone, and the function of those hormones is to not let you get pregnant. And those hormones also, one of the side effects can be vaginal dryness.
Okay. So that's something to also keep in mind, no matter how aroused you are by your partner. I mean, the arousal will, of course, make other things better, like it'll prepare the vagina, it'll make the cervix move up and back a little bit, so it'll get you ready for sex, but it won't necessarily provide the lubrication. I think we need a whole separate podcast on just that. Okay, rushed or forced penetration. Sometimes you're like, I want a quickie, or let's have a quickie. And very rushed penetration can also damage some
It
of the
can,
tissue
yes.
and make you bleed.
It can, yes. Because once again, we have to come back to the topic of lubrication to address this issue. Because if you're rushing, then the tiny little glands that produces the lubricant, if you're relying on your own lubrication completely, they are not yet ready. They may want to take their own time. Mind and body doesn't always work in sync, does it?
Absolutely.
So things are dry, and all of a sudden penetration can cause some bit of injury, which can lead to bleeding and pain also.
And pain also. Now, I know that while I was trying to look this up, I realized that there are certain underlying medical conditions which can actually make you more prone to bleeding. And what I came up with, and you can tell me what you think. So there's something called the clotting disorders. So there's clotting disorders. There is something to do with the cervix where the sensitive cells from inside the cervix become exposed. So I'm just going through some of these things so that you can then pick them up and address them. Some kind of vaginal or cervical trauma, which we've just addressed as rushed or forced penetration. But can we talk about either the clotting disorders or where the cells from the cervix become exposed?
So clotting disorder can either be hereditary, i.e. you're born with it, or something that you acquired later in life. I mean, this is not a lecture on clotting disorder, so we don't need to go into the depth of it. But basically what it means is that your blood is more likely to come out from any kind of injury in any part of the body, including your period blood can be heavier than usual. Now, clotting disorder, because it can make you bleed more, for minor vaginal injury during intercourse, which in other situations the clotting mechanism of your body would have addressed it right then and there. But in these kinds of conditions, they may not have the capacity to stop you from bleeding. Because our body is immensely clever. It does things that we don't even realize. Isn't it? I mean, we have got something called clotting cascade and a kind of cell called platelets, and they are all always fighting with external forces trying to stop us from bleeding to death. But sometimes, unfortunately, they may not function as well as we would like them to, and in those cases, you can bleed more during your periods, from other injuries, and also after having sex. Also, when we're talking about clotting disorder, there can be another situation which is not a clotting disorder, but where you need to take a blood thinning medication.
Okay.
So there can be various reasons why you can be on blood thinning medication, maybe because of some heart problem or some kinds of stroke, or even when you have had major surgery, then we give blood thinning medication because a life-threatening blood clot is a real risk after having major surgery. Even something like after cesarean section or a complicated vaginal delivery, we do prescribe blood thinners for a few days at least so that they remain safe. But one of the things that can happen with blood thinners is that if the blood is a bit too thin, then you can bleed easily.
Okay. Yeah, so that's one thing with the clotting. And the cervical cells.
Yes. So cervix is what we call the neck of the womb. So the womb is a pear-shaped organ, and then it ends in a kind of a almost slightly thicker than a cylinder, which is called the cervix, and the cervix is opening up into the vagina. So when you are having penetrative intercourse, it is likely that your partner's penis is going to touch the cervix.
Or the opening of the cervix.
The opening of the part of the cervix that's jutting into the vagina.
Yeah.
Now, you mentioned about ectropion. So ectropion is a condition where you rightly mentioned that cells that usually are tucked inside the cervix, they tend to come out. And it looks like what we describe, I know it's not a very nice description, but it looks like an angry looking area, i.e. it can look red and inflamed. Now, once again, ectropion is not necessarily an abnormal condition or a disease. ectropion can naturally occur in a woman's body because of the interplay of hormones. You know, estrogen and progesterone, they are like doing their own little salsa. And sometimes, you know, things can fly all around in the form of ectropion. But ectropion can also bleed to touch, and penetrative intercourse is a situation where it's likely to be touched. So that's one condition. The other condition of the cervix that can also bleed to touch is a polyp.
Okay.
A polyp is like an extra growth of skin, almost like a skin tag. It can be of various sizes. Most of them are not cancerous. Okay, most of them are benign, but they can also bleed to touch and lead to bleeding during sex.
So just to clarify, when Dr. Dasamapatra says ectropion, that means that those are the cells that should normally be inside of the cervix,
yes,
but are now slightly at the mouth of
yes,
the cervix and easy to touch. So that's what the term means.
Exactly.
Okay.
And also it's important to remember that there's nothing we can do that can change this for us.
Okay.
So good food, diet, exercise, yoga, they are all lovely. But unfortunately, if this happens, either the polyp or the ectropion, then it's not something that we can change with our lifestyle.
So polyp, of course, can be removed surgically. Can these cells also be removed surgically?
So if an ectropion, for most cases, we don't need to do anything. The body will just, when the hormone level differs, then it's going to change.
Oh, sorry, just one question. So you're saying that these cells become more sensitive at the dance of the hormones, the progesterone, estrogen dance. So they're not always sensitive. They can sometimes be sensitive.
No. What I mean is that because of the way the hormones work, sometimes the cells that are inside can come outside and form ectropion.
Yeah.
And especially in young women. Now, ectropion also, if it's significant enough to cause, persistent problems, bleeding, then we do have some minor surgical, sometimes not even a full-on surgery is necessary. Sometimes we can do it in the outpatient clinic during examination. So we have got a few tools in our arsenal which we can use to control bleeding from ectropion. And I know a lot of you will probably be looking at Google, looking at searching with all the names. So if you search with ectropion, you might also come across another word that used to be used for it. It's called erosion. Now, technically, nothing erodes.
Okay.
So cervical ectropion can also sometimes be referred to as cervical erosion, but please remember that nothing is eroding inside your vagina.
Okay, that's useful to know. So basically, these are things that can cause bleeding during sex. And the ectropion or the cervical cells, the sensitive cells, can cause heavy bleeding or a light bleeding, generally speaking.
Generally, it's light, but it can also cause heavy bleeding.
Okay, so that's good to know. Also, any kind of infection or inflammation of any kind, like an STI maybe?
Yes, STI, what we call cervicitis, i.e. an inflammation of the cervix, which most often is STI related. That can also make the tissue of the cervix sensitive. Basically, when any tissue is sensitive, then it can become friable. And when it's being pushed against, it can show signs of not being happy by bleeding.
Okay. So basically, I think what we're saying is that if there is consistent bleeding, it's not just because there wasn't enough lube. It's not just because your hymen broke. It's not just because you're menopausal and you've gone dry. There can also be certain medical underlying conditions. Yeah. So if it's happening, you need to actually go and see a doctor.
Absolutely, yes.
And I want partners to be aware of this as well, because a lot of times, unfortunately, partners seem to think, because, there's this myth around sexual health that, especially if things are happening inside a vagina, it'll get okay. I don't know, for some reason, there's just not enough importance given to it. that one of the conditions could actually be an STI, which, if it is not sorted, could also be communicated to you. So you are equally at danger.
Yeah.
Please make sure that this is something that's dealt with. Okay, so coming to what we can do in terms of tests or examinations, or what we can approach the doctor with, because sometimes I find that even approaching a doctor is scary.
It is.
And you don't know what they're going to say to you. And there is just so much ridiculous judgment and stigma around almost any kind of sexual health issues. So maybe we can now talk about what kind of information they could have, which they can then go to the doctor with. Like what kind of journaling, etc., they might have to do. So it's something that they can actually. So I kind of wrote it all down because I was a bit nervous of getting even my questions wrong. I didn't want to do that. So we've already addressed the first thing, that, what is the signs that indicate that you need medical attention? If it is consistent bleeding, you
if it's
need
consistent bleeding, yes, definitely. If you feel dizzy, lightheaded, definitely.
And again, going back to that point where, as Dr. Dasamapatra said, that it could be that you didn't, suppose you've had multiple partners, maybe you didn't get bleeding with your first partner, but you are getting bleeding with your second partner. It doesn't matter how many years you've had sex. Bleeding can happen at any point of your sexual life.
Yes.
And it can happen for different reasons. Sometimes it's okay, sometimes it's not. So what kind of tests or examinations would you recommend for someone who's had unusually heavy bleeding the first time? So I know that we've kind of talked through that it could be vaginal septum, it could be a number of underlying health issues, etc. But, and this I'm talking about either the first time that you've had sex or the first time that you've experienced this kind of heavy bleeding. What are the different types of tests or examinations that you should be asking for?
Yeah. So do not try to self-examine if there's a concern with bleeding, for multiple reasons, i.e. you can inadvertently introduce infection, or, most of us may not have long nails, but still we have nails, and whatever we have can increase any kind of injury if it is present. As a basic examination, what we do is we use something called speculum. Now, a speculum is, nowadays, at least in the UK, we use disposable plastic speculum, but we also have metallic speculum that can be sterilized and reused. So it can be either made of metal or made of plastic, and it has got two blades like this which open up, which helps us gynecologists to look inside the vagina and check all the tissues that are inside. So that is one examination that we will have to offer.
I just want to add to that. So it's like a little narrow, longish thing that has
I wish I
these
had
two-
a speculum. I would have brought one if I knew.
I was just going to say, okay, personally, I detested those things.
I do
every
too.
time.
I'm with you, Seema.
Every time I went for my cervical smear, it was like that thing was put in and then it opens up and you're like, what are you doing to me? But yeah.
It's so fun being a woman, isn't
No,
it?
it's exactly. It's like, yay, I get stuff like this pushed inside me and opened up, like, but yeah, it's like a torture instrument. But
It does look like a torture instrument, in all fairness.
okay, so you can use the speculum to examine the patient.
To examine inside. And the other test that we will be doing is a blood test to check for your hemoglobin levels, because if there's concern with bleeding, then we obviously have to check for anemia. Most of you will not have anemia from bleeding from sex, but we still should look for it. And also, blood test also helps to look into a clotting condition.
So I think, okay, so those are the different tests and examinations that you could, okay, I've also written down that, if heavy bleeding happened during first time sex, and if there is a condition where, let's say that the cells around your vaginal wall are thinner, or the skin around there is thinner, and that's likely to happen again. Or if your partner is quite big,
Yes.
and that
Yes.
is likely to happen again.
Yeah, it's a mechanical injury.
Yes.
So we have talked about a lot of different things, lubricants and everything, but you can have everything in order but still have an injury during intercourse. And we have seen that as gynecologists, and some women, very few of them arguably, please do not be afraid of having sex or experimenting with sex, but sometimes minor surgery may be required to stop the bleeding.
Okay.
But there are things that you probably need to be addressed if you're persistently bleeding, but sometimes you can bleed even when everything looks normal.
And this is why we actually recommend for almost any kind of condition that is over a period of time, that if you can actually journal it, keep a
Yes.
little diary,
Yeah.
write it down, note down